A curfew will be imposed in Bangkok as Thailand fights its worst outbreak of COVID-19. There will also be limits on the size of gatherings and restrictions on unnecessary travel between provinces. And more than 9,000 new infections have been reported, a new record. Across Southeast Asia, many governments are struggling to contain new coronavirus outbreaks, driven by the Delta variant.
Hundreds in Bangkok have traded their beds for a spot on the city's streets. Others have set up shop outside the city's famous temples. They're all waiting in line to get free COVID-19 tests at one of Bangkok's 5 testing centres. It's a necessary trip for some, as testing is required at work. But many have been turned away due to the overwhelming demand.
วันนี้มาตั้งแต่5 ทุ่มครับก็ครั้งที่3แล้วครับผมก็จำเป็นไม่ให้ตรวจจำเป็นครับเพราะว่าถ้าเราไม่ตรวจเขาจะไม่ให้เราทำงานครับอันนี้สำคัญครับ
Hospitals have already suspended testing due to the shortage of beds as cases continue to surge across Thailand. COVID-19 tests can also cost more than $80 a person at private hospitals, a price which some cannot afford.
ก็เราก็อยากมีสิทธิแบบนั้นนะแต่คือกำลังเราไม่มีอ่ะเราก็ต้องเก็บเงินส่วนนั้นเอาไว้กินเพราะว่าก็ต้องรู้เดี๋ยวก็ต้องล็อกดาวน์ล็อกอะไรใช่ไหมเราจะเอาเงินที่ไหนไปใช้แม้กระทั่งไข่สักแผงหนึ่งเราก็ต้องกระเบียดกระเสียนซื้อ
It's not just Thailand. Having escaped the worst of the pandemic last year, much of Southeast Asia is now facing the force of the more contagious Delta variant, derailing containment efforts. Cases in Indonesia have surged 6 times from a month earlier, with hospitals in Java pushed to the limit. Vietnam has reported more cases in the past 3 days than during the first year of the pandemic. Record case numbers and fatalities are also being reported in Malaysia, Myanmar and Cambodia.
For more, let's go to Saksit Sayasamba joining us from Bangkok. Saksit, it's a much-needed lockdown to contain the surge, isn't it?
In light of the ever-increasing and escalating COVID-19 numbers here in Thailand, yes, it is definitely much needed, especially the new number of cases that we had on this Friday, 9,000. Was definitely much of a big shock. That is something that people wouldn't have imagined just a few months ago, but now we have thousands of new cases every day, dozens of deaths every day, and also hospital beds now filling up very quickly here in Bangkok. Now, those measures were expected to come. It was expected that we were going to call a night curfew. It was expected that many businesses and many locations are going to close, as well as the sizes of gatherings are now being reduced to 5, and also interprovincial travel is being restricted, but it's not being restricted as it is banned, but being severely discouraged. For example, if you're coming from Bangkok and go to another province that is not as infectious, you might encounter some restrictions. For example, you'll be asked to quarantine unless you're vaccinated. Now, just before we came on air, Air Asia has also announced that they're going to suspend all domestic flights for the rest of the months as well. So we are seeing that these are all measures that are much needed. And critics have actually said these were long overdue. They should have been done actually at the onset of this current wave that we have since April. And now it's being accelerated much more because of the variants. First it was Alpha, now it's Delta. But is it really a lockdown? Well, as the Thai saying goes, same, but different.
How much of a setback is this then for the Prime Minister's deadline to open Thailand's borders?
It doesn't really look good right now. The goal to reopen the country by October-ish seems very distant now, even though they have just recently launched the so-called Phuket Sandbox trial, where fully vaccinated tourists can skip quarantine and roam around the island for 2 weeks. That is still in effect. That is not being affected by the newest measures, which are only for Bangkok and the surrounding provinces, and also 4 provinces in the deep south as well. So Phuket and many other places in Thailand are not really affected by the strongest of the measures as well. But one of the main factors in order to reopen the country again is vaccination, and that is still going at a very slow pace. Not even 14% of the population have gotten the first needle. Not even 4% have gotten the second needle and are fully vaccinated. And the goal to vaccinate them to vaccinate 70% of the population by the end of the year. That seems very distant. And of course, all that is increasing the pressure on the government of Prayut Chan-o-cha. Many criticisms that people had over the past few months that they haven't done enough. But then the government has also said, of course, that there needs to be a balance between the economic damage and the damage on the healthcare system. But now it seems to be that the scale is tipping over one way or the other. And that's why the government is forced to do all these measures. But it seems to be we have to wait and see how much they're actually going to push the numbers down.
Saksit Sayasambhat in Bangkok. Thank you.